Welcome back to the King's Podcast, The Wellness Dive with Lackie. I'm your host, Esther Lackie. March is Endometriosis Awareness Month. Today we have Dr. Marlain Mubarak, Consultant Obstetrician and Gynaecologist, the expert in endometriosis. Actually, the only expert, I think, here in the UAE, Doctor.
Well, we have Professor Wattiers, who's fantastic surgeon as well. So there is, few of us who are experienced in really advanced complex laparoscopic surgery for endometriosis.
And then before we take a deep dive into endometriosis, we're going to get a little bit controversial. You are one of the two main experts in endometriosis here in the United Arab Emirates. But there are other doctors who claim to be the best in endometriosis. How does this work?
Endometriosis is a really complex disease. There's not enough known about it. The training for endometriosis and endometriosis surgery is very complex. Not many centers provide the type of really advanced training. When I started training in endometriosis in Oxford in 2004, 2005, there was only 3 centers in the UK. The diagnosis is quite challenging. Part of the problem is women pain is completely ignored. So period pain is regarded as normal, whether it's by the women themselves, their moms, their friends, it's normal. It will go away when you get pregnant. The diagnosis is quite challenging. Ultrasound scan only can tell us if there is a chocolate cyst on the ovary. And ultrasound in expert hands can give us a lot of information about, the severe endometriosis, the deep infiltrating endometriosis, which is my biggest passion, and this is my work. 1 out of 10 women have endometriosis. Most probably the incidence is more than that, but it's really difficult to diagnose. The way it affects women's life is unbelievable. It affects the quality of life. Women who have endometriosis are more likely to have depression, and that's all the data and studies show that. Women who have endometriosis find it more difficult to get pregnant. Interesting, 40 to 50% of women who can get pregnant, they have endometriosis, but it's not diagnosed. 30 to 50% of the women who have endometriosis, we know they have endometriosis, find it very difficult to get pregnant. The challenges is to think endometriosis as a clinician and as a woman. I always feel that information is power. If you empower women, give them the information, then they can ask their clinician, what are you doing? Is this endometriosis? Can we do something to check? And always I say, please ask your doctor. If your doctor says surgery, ask your doctor, what is your expertise? What is your outcome? What is the chances of this disease coming back? I think I would say 70% of the women I see in my clinic are pelvic pain endometriosis. A lot of them come to me after they had so many surgeries and they've lost their ovarian reserve. I feel it's wrong to say March endometriosis awareness. Every day have to be endometriosis awareness. Women health is ignored. It should be at the top of the agenda. The woman is a sister, is a mom, is 50% of the population. We should not ignore this disease, how it affects them, and how it affects the whole family. Yes, period pain a little bit, scoring 2 out of 10, 3 out of 10, day 1 of the period is not a problem whatsoever. It's just normal. One important point is if a young girl, the moment her period starts, it's painful, we later on will diagnose them with endometriosis. And that is really so typical. One thing I would love to do is to pick up these young girls from the beginning, in the emergency at the time of the period, to take some injections for pain. If we identify these young ladies from the beginning, we will change the whole course of the disease. Endometriosis is a chronic, recurrent, progressive disease. The way we manage it is medication and surgery. You can't really divide. If you do surgery, you still need to use medication. And the easiest way to think about it, if you have a plant and you stop watering it, it will stop growing. Endometriosis need estrogen to grow. Endometriosis itself releases estrogen. So all the treatment is hormonal to stop the endometriosis from producing estrogen and growing and getting worse. And hopefully you will shrink it. And that's the principle of the medical management. When we do surgery, when I do surgery, the most important part is to establish accurate diagnosis. I'm fortunate, I'm quite good in identifying the severe endometriosis on ultrasound myself. I'm expert in endometriosis. I've just been to Europe last week and did a workshop, and it was fantastic. We have an excellent team who can do MRI for endometriosis. By the way, in the whole of Dubai, there is barely 5-6 radiologists who can really identify severe endometriosis on MRI. And we have 3 of them or 4 now in Kings. My work, I've been an endometriosis lead surgeon accredited by the British Society of Gynaecology since 2013 in the UK. I've done a lot of research in Oxford in endometriosis. And my biggest passion is to really diagnose accurately. Then when I know how much endometriosis a woman has, then I can decide whether I'm going to surgically treat her or medically treat her. There is not one treatment for all. One thing I really wanted to talk about today is the ovarian reserve. What I see, a lot of the women who they found that they have a chocolate cyst on the ovary, whether it's 3 centimeters, 5 centimeters, 7 centimeters, and their gynecologist saying, rush, rush, you need surgery, otherwise it will rupture or it will twist. Chocolate cysts, extremely, extremely rare, will rupture spontaneously or twist.
What is a chocolate cyst?
Chocolate cyst, endometrioma, as cyst on the ovary full of old blood. So it looks like melted chocolate, and that's what we call a chocolate cyst. It's usually stuck to the pelvis. It doesn't move, it doesn't twist. I've barely seen 2 in my whole career going back, to the 90s. The problem when you touch the ovary, the cyst itself affected the ovarian reserve. And then we surgeon nicely strip that cyst and remove it, we destroy further the ovarian reserve. The cyst comes back and we do surgery again. By the time they reach me, their ovaries are dead and they lost any chance of getting pregnant. So that's why it is important that women should ask their doctors and ask questions, go for a second opinion, do homework, do the research. We put a lot of work on our website about endometriosis and endometriosis awareness. We posted a lot of videos of women who had surgeries, their experience, and it's interesting to see all these women had the same experience, repeated surgery again and again. Their pain is ignored, they can't get pregnant. So it's the same whole story again and again.
And over. Oh, doctor, I have no words.
So
You've left me speechless.
I think that my last message to all women, please, period pain is not normal. Pregnancy does not get rid of it. Endometriosis is a chronic disease. Please see the right person. Please ask the right questions and do your homework, do your research, and then decide based on evidence what is the right thing for you. I always say I never would sign a check blank and give it to somebody. Why would I let a surgeon to go inside my tummy without knowing exactly what they are doing, how good they are, what is their outcome? Be British. British people are fantastic in asking these questions. Just ask questions. Thank you.
Wow, doctor. Thank you so much for coming. There you have it. I have nothing to add. Until next time. See ya.